So if someone's in pain, we have to find out why they are in pain. So if someone comes to me and says, Barbara, I've got a very sore lower back, I can hardly handle the pain, I put my detective hat on. Remember Newton's third law of motion? To every action there's an equal and an opposite reaction. The Newton's third law of motion was already defined in the Bible. I wonder if Sir Isaac Newton wrote, or read, I should say, his Bible. So in Proverbs 26 verse 2, the Bible says, be not deceived, God is not mocked. Whatsoever a man soweth, that he shall also reap. I'm sorry, that's not found in Proverbs 2:26, that's found in Galatians 6 verse 7. In Proverbs 2:26, the Bible says that the curse causeless shall not come. In other words, no problem happens without a cause.
Have you experienced back pain that just won't go away? Well, as we age, this becomes more common than you might think. Research shows that nearly 80% of adults over 50 experience some form of back pain at least once in their lives, and for many, it becomes a regular issue. In seniors, back pain can affect mobility, sleep, and even mental health. But it doesn't have to control your life. What if I told you that in many cases, simple changes in daily habits can make a big difference? So how do you identify what's causing your back pain? And more importantly, how do you fix it? Stay tuned as we break down the most common causes of back pain and the remedies that can actually work. Before we begin, take a moment to comment below and let us know where you're watching from. Also, make sure to like this video and subscribe to the channel if you want to see more videos like this. Let's jump into it.
I have known many people to conquer back injuries by strengthening the core muscles. You see, the core muscles in our abdominal area, they're all linked to our lower back. But this lady apparently is seeing a physiotherapist. So the other thing that I would do, and I don't advise pain-killing medication because of the way it damages the liver, the kidneys, and also kills off our good flora in our gut, that most people don't realise that high doses of cayenne pepper has a pain-killing effect because cayenne pepper is a natural analgesic. And here in the US, you can buy tablets called Cool Cayenne. And the cayenne, I think it's with aloe, I'm not sure, but it means that as it's coming out the other end, it doesn't burn too much. So that's what I would advise.
Let's start with the causes of back pain. Understanding what's really going on can help you take the right steps to ease the discomfort and avoid making it worse. Number 1, poor posture. Slouching at a desk, hunching over a phone, or standing with the hips pushed forward can all place uneven load on the spine. Over time, those small strains add up. When you round your shoulders or let your head drift forward, the muscles in your neck and upper back work harder to hold you up. That tension then travels down, causing stiffness and pain in the lower back. Even sitting with your feet tucked under you or crossing your legs can twist your hips out of place, forcing your spine into an awkward curve. Good posture keeps your ears, shoulders, hips, knees, and ankles in a straight line when viewed from the side. But when that alignment is off, ligaments that support the spine must overwork. Imagine carrying a heavy backpack on one shoulder only. Eventually, you'd feel sore on that side. The same thing happens inside your body when posture is uneven. Many of us spend hours each day seated. Without reminders to sit up straight, we fall into habits that strain the back. Simple fixes like an ergonomic chair, a footrest, or taking short breaks to stretch help retrain your body. Even standing desks aren't a cure if you lean forward all day. The goal is neutral spine, a gentle S-curve that lets muscles rest instead of fight gravity.
Exercise. And the person says, you don't understand, I can't exercise because I'm in pain. There will be a type of exercise that you can do. And that's why I say to people who have lower back problems, go to a physiotherapist, define exactly where the problem is and get them to show you what you can do to strengthen all the other areas of your body and help your body compensate with that injury that's there. See, once the injuries has happened, you got scar tissue there. You've also got possibly a little bit of arthritis building up in there. So there might be different things happening. And what I found with some people, they just want me to give them a herbal alternative to morphine. Well, there isn't one. Do you know, there are some things that can help a little bit, and we will be looking at those. So the true remedies is what you go to. You've got to go to the temperance. You've got to stop the caffeine, stop the alcohol, stop the refined sugar, stop the acid-forming foods.
Number 2, muscle strain and ligament sprain. Lifting a heavy box, reaching for something awkwardly, or twisting too fast can pull or tear the muscles and ligaments that support your spine. Muscles are bundles of fibers that contract to move bones. Ligaments connect bones at joints. When those fibers stretch past their limit, you feel a sharp pain, tightness, or muscle spasm. Sometimes the onset is sudden, like lifting grocery bags without bending your knees, and you feel a pop or snap. Other times it builds slowly from doing a repetitive task, such as mowing the lawn or shoveling snow with poor form. Once a strain or sprain occurs, the body responds by sending extra blood to the injured area. That leads to swelling and warmth, but also cramping and reduced range of motion. Even simple activities, standing up, reaching down, can trigger pain, making normal tasks feel impossible. Rest can help in the first day or two, but too much rest lets muscles weaken and stiffen, which may prolong recovery. Number 3, disc problems, bulging and herniation. Between each vertebra in your spine lies a disc, a soft gel-filled cushion that absorbs shock and lets your spine bend and twist. A bulging disc happens when the soft center pushes outward but stays within the outer layer. A herniated disc occurs when that outer layer tears and the inner gel leaks out. Both conditions press on nearby nerves, causing pain, numbness, or weakness in your back, hips, legs, or even arms, depending on which level of the spine is affected. Bulging discs often develop from gradual wear and tear, especially after age 30. Lifting heavy objects with your back instead of your legs, twisting motions, or sudden impacts like a fall can trigger a herniation. Genetics also play a role. Some people's discs weaken earlier. Symptoms vary. You might feel a dull ache, a sharp shooting pain, or a burning sensation that travels down a limb. Sneezing, coughing, or sitting for long periods can worsen it because these actions increase pressure on the disc. Number 4, osteoarthritis and spinal stenosis. Osteoarthritis is wear and tear arthritis that gradually erodes the cartilage cushioning your joints, including those in the spine. As cartilage wears away, bones rub against each other, causing pain, swelling, and reduced flexibility. In the spine, this can lead to bone spurs, small bony growths, that narrow the spaces where spinal nerves pass through. That narrowing is called spinal stenosis. Spinal stenosis often shows up in people over 50. It develops slowly, so you might notice mild stiffness at first, especially after standing or walking for a while. Over time, you may feel tingling, numbness, or weakness in your legs, making it hard to stand for long or walk without rest. Some describe a heavy feeling in the calves or pain that eases only when bending forward, such as leaning on a shopping cart. Now let's discuss natural remedies for back pain.
Rest. We need to have 8 hours sleep a night so that rest and rejuvenation and regeneration can happen in the tissues. Listening to the body is absolutely number 1. Remember what I did on the plane? Now, if the ice hadn't stopped the pain, and I knew it would, maybe I would have resorted to painkillers, but I never had to in my whole experience go to painkillers. I just used the ice. So how do I know that the ice was what to do? Because I know it gets the inflammation down and my pain started to reduce. I had plantar fasciitis, it was about 5 years ago. I wondered why my right foot was hurting so much. I was doing all sorts of things that was still in pain, so I went to the doctor and I said, I want to know what's happening to my foot. And it was the foot that I had landed on many years ago. I did that when I was 49, so I'm in my late 60s now, but this happened probably when I was 60 or late 50s. And I thought maybe it's a problem happening from when I did the skydive. And he had a look, he felt around my foot, and then he laughed. He said, "You've got plantar fasciitis." I said, "What? Plantar fasciitis?" He said, "Yes. Have you changed your running shoes?" I said, "I have. I'm doing barefoot runners now." He said, you've been going at the running too hard. You've stretched and inflamed your plantar fasciitis, which is on the bottom of the foot." He said, that will take 10 months to heal. And that was it. He said, "I could put a cortisone injection in to get the inflammation down." I said, "Nah, leave it with me. I'll work it out." So I started to do the hot and colds. Now I would be lecturing for 2 hours, and by the end of the lecture, I'm actually getting this foot up. It's, I'm getting to 8 out of 10 pain from just being on my feet for a couple of hours. I'd go home and I'd do the hot and colds, and I could bring the 8 out of 10 pain right down to 2 out of 10 pain. It was just incredible the difference that the hot and colds made. And then at night, I would rub the comfrey into it. I knew that I just had to be patient. I also needed to be careful not to be on my feet on cement. I had to be careful with the shoes that I was wearing. I had to make sure I had well-fitting shoes. So I would say every day without exception, I did the hot and colds at least once. If possible, I would do it twice. I found to fit it in, you just have to make an appointment with yourself. If you don't make an appointment, the day will go and you'll never do it. And then you'll really suffer when you go to bed because it'll be aching and you'll think, "Oh, why didn't I do those hot and colds?" Because it brought me so much relief.
Hot and cold treatment. Alternating between hot and cold treatments is one of the simplest and most effective natural ways to manage back pain. Cold therapy is best used in the first 24 to 48 hours after pain starts, especially if the pain is from a strain, sprain, or inflammation. Applying cold helps reduce swelling and numbs the area, which eases sharp or sudden pain. Cold slows down blood flow to the affected region, calming nerve activity and preventing the pain from spreading. You can use a cold pack, a bag of frozen vegetables, or a towel-wrapped ice pack. Place it on the painful area for 15 to 20 minutes at a time. Always put a cloth between the ice and your skin to prevent frostbite. Cold therapy works best in short sessions, several times a day. After the first couple of days, or if the pain is more chronic or muscle-related, switching to heat can help. Heat increases blood flow, relaxes tight muscles, and improves flexibility. It's especially helpful for people with stiffness or chronic tension. You can use a hot water bottle, heating pad, or even take a warm bath or shower. Apply heat for 20 to 30 minutes. Avoid using high temperatures and don't fall asleep with a heating pad on, as that can burn the skin. Moist heat, such as a warm towel or steamed wrap, often works better than dry heat because it penetrates deeper. Now here is another method of hot and cold treatment.
We did hot and colds in the sitz baths. See, with the sitz baths, you've got a tub like this, and he would sit in the tub like that. So the water's like this. And we put a big smile on his face because this brought him incredible relief. So we did hot for 30 seconds, and we did hot for 3 minutes, cold for 30 seconds, and we did that 3 times. We did it every morning and every night. And he had no accidents when he was with us.
Some people find that alternating between cold and hot works best. This is called contrast therapy. Start with cold to reduce inflammation, then follow with heat to loosen muscles. It's important to listen to your body. If either hot or cold seems to make the pain worse, stop using it. This simple remedy is low cost, easy to do at home, and doesn't involve medication. While it won't cure the root cause of back pain, it provides relief and supports healing by managing symptoms naturally. Comfrey poultice. Comfrey is a medicinal herb that's been used for centuries to treat joint and muscle pain. Its roots and leaves contain compounds like allantoin and rosmarinic acid, which promote cell regeneration and reduce inflammation. One of the most traditional ways to use comfrey is by applying it as a poultice directly on the skin over the painful area. To make a comfrey poultice, start by crushing fresh comfrey leaves or using dried comfrey soaked in hot water. Once softened, wrap the herb in a clean cloth or gauze and place it on the affected part of the back. Leave it there for 20 to 30 minutes. You can do this twice a day. You can also apply a thick paste made from comfrey powder mixed with warm water, wrapping it with a cloth to hold it in place. Studies have shown that topical comfrey is effective in relieving lower and upper back pain. In one study, participants who used comfrey extract cream reported a significant reduction in pain intensity within just a few days. The anti-inflammatory effect works by calming irritated tissues and promoting circulation in the area, which helps speed up healing. Comfrey is especially helpful for muscle spasms, arthritis-related pain, or soreness from overuse. It can also help with bruising and swelling. However, it's important to know that comfrey should only be used externally. Internal use, like drinking comfrey tea, is not recommended as it may harm the liver. Before applying it regularly, do a patch test on a small area of skin to make sure there's no allergic reaction. People with sensitive skin should consult a healthcare provider first. If you're pregnant or nursing, it's best to avoid comfrey altogether. With its natural healing compounds, comfrey poultice is a powerful herbal remedy that supports recovery and pain relief without the side effects of conventional medication. Diet.
What's the diet like? Very important that the person be eating a plant-based diet because the body can't heal unless it has the nutrients. And those nutrients, remember, are high fibre, generous proteins and healthy fats, especially the greens with their minerals.
Ice bottles. Using ice bottles as a therapy tool for back pain is a practical and affordable home remedy. The idea is simple. Fill a plastic bottle with water, freeze it, and then use it to roll or press against the sore area. This method combines cold therapy with massage, which can relieve tightness, reduce inflammation, and improve blood flow all at once. To use an ice bottle, take a regular-sized water bottle, preferably one that's sturdy, fill it about 3/4 full and freeze it overnight. Once frozen, wrap it in a thin towel or pillowcase to protect your skin. Then lie on your back or sit in a chair and place the bottle under the painful area. Slowly roll your body back and forth over it, letting the cold penetrate the muscles while the shape of the bottle works like a mini foam roller. This technique is especially useful for pain in the lower back caused by muscle strain, overexertion, or even poor posture. The rolling motion releases tension while the cold helps numb the nerves and reduce inflammation. You should do this for about 15 to 20 minutes at a time, 2 to 3 times a day. For people who have trouble with balance or mobility, the bottle can also be used while seated. Just place it behind your back and lean gently into it, applying steady pressure to the tight area. This is a great way to combine deep tissue massage and cold therapy without needing expensive equipment or a visit to a therapist. Some people even add a bit of rubbing alcohol to the water before freezing. This prevents the bottle from turning solid, creating a slushier texture that molds better to your body and feels more comfortable during use. This method is safe, effective, and easy to customize. Just make sure not to use it directly on bare skin, and don't use the bottle longer than recommended to avoid skin irritation or ice burns. Over time, regular use of this technique can significantly reduce pain and stiffness in the back and improve day-to-day comfort. Back pain might be common, but that doesn't mean you have to live with it. Whether it's improving posture, staying active, or making small adjustments in your routine, there are practical ways to feel better. If the pain continues, don't hesitate to talk to a healthcare professional. Thanks for watching, and don't forget to take care of your back. It supports you more than you know.